My name is Corinne Young. I'm a nurse practitioner in pulmonary and sleep medicine, and I work in Colorado Springs, Colorado. I'm also the president and founder of the Association of Pulmonary Advanced Practice Providers. I think it's very important for all providers to know their transplant center, know the people there, know their recommendations of when they want to see patients and what they consider a good candidate and not. The general consensus is patients under the age of 70. So when I have patients who are 70 plus who have very bad COPD and they want to talk about transplant, we still have that discussion that there are some high risk transplant centers who may see you over the age of 70. However, our local transplant center in Colorado, generally, 70 is the cutoff for them. And so if they want to go out of state, let's talk about that. Also, I like to have, and I think everyone should have, the transplant discussion early with their patients, way before they ever need it, because patients need to understand that when your lung function gets to this level, that's when you're considered a candidate for transplant in our area. However, you have to be smoke-free for at least 6 months before they will even talk to you. So let's make sure that we're addressing your smoking cessation, because I've had some patients who said, well, I thought I would smoke until my lungs were bad enough and then I could get a transplant and quit. And it doesn't work that way. And so also we want to understand what our patients' goals are in relationship to transplant. Would you ever consider a transplant? Would you ever want to talk to the transplant center? Or would you consider going and talking to them to see if this is something you would consider? Because for a lot of patients, it's not. And there are so many outside influences to them getting a transplant, like a caregiver that can be with them, getting their prescriptions, taking them to appointments. They have to have a very committed caregiver. I've had patients who have not qualified for lung transplant because they did not have a reliable caregiver. The patient was a great candidate, but they didn't have the caregiver in place to help them post-transplant, so they were denied by their team. Making sure that the patient understands that most all insurances are going to cover this. This is a big financial concern for a lot of patients, that I can't afford a transplant. It must be absolutely astronomical for me to be able to afford that. But most medical plans will cover it. And if they do have something that has a very high deductible, they have high copays for their medications, oftentimes these transplant centers will have the patient fundraise a certain amount of money prior to their transplant to make sure they can cover all their post-treatment that they're going to need in relationship to transplant. I also like to make sure that the patients understand the outcomes and of transplant on the other side and why we choose transplant. If it looks like your survival is going to be lower without a transplant versus with a transplant, that is when it's recommended. It's not purely just to improve your symptoms of COPD. You really have to be in that stage of COPD where your 5-year survival is so low that it actually looks significantly improved with a transplant. So I think those are all really important conversations to have with your patient. And we don't want to wait until the end to send these patients when they're end stage, when their FEV1 is, less than 30%, because it can take a while to work these patients up. They have to make sure that all of their other screening is done, their mammograms, their colonoscopies, PSAs, whatever it might be, that they've been cancer-free of any type for 5 years or more. If they have pulmonary nodules, which are very common in these patients, that they've been stable for the prescribed amount of time, depending on the size. So there's a lot of things that could delay these patients being approved for transplant. And if you already send them at the end stage of their lung disease, are they going to run out of time during their workup before actually needing their transplant? So we always want to send them early to transplant and to pulmonary, and primary care. I can't say enough. Please send them to us. We will see them in the very earliest stages of their COPD to make sure we can confirm the diagnosis, confirm staging, confirm that they're on guideline appropriate therapies, to make sure the patients understand their disease state and when they need to be treated aggressively, and to make sure they understand that there is this concept of transplant and interventions, interventional pulmonology options like endobronchial valves and other procedures to help improve their COPD symptoms.